Good morning, good afternoon, and good evening. Hey guys, welcome back to the channel. My name is Omer, and I'm a doctor. My passion is to share valuable knowledge that can enhance and potentially save lives. My mission is to empower you with information that can make a real difference in the world. In this video, I'll be discussing everything you need to know about pulmonary fibrosis, including its causes, symptoms, risk factors, treatment options, and much more. So, let's get started. Respiratory system. Before I talk about pulmonary fibrosis, let's talk about how our airway system is made up. The following is the analogy I use with my patients. So imagine a big tree with its trunk, big branches which then split to smaller branches, and you get leaves at the tips of the small branches. Now that you have a clear picture of this in mind, flip this tree upside down. This is your airway or respiratory system, and I'll explain how. Your windpipe, also known as your trachea, is the tree trunk that travels down and then separates into medium-sized branches called your bronchi. These then split into further smaller branches in your lungs called bronchioles. At the end of these branches you have leaves, which are the alveoli. These are tiny air sacs where your body absorbs the oxygen from the air you've breathed in and gets rid of the carbon dioxide in the air you breathe out. Interestingly, actual tree leaves do the opposite via photosynthesis, and that's why this is a surprisingly good analogy. It is useful to understand what the following words mean. Pulmonary means affecting the lungs. Fibrosis means thickening or scarring. Idiopathic means of unknown cause. What is pulmonary fibrosis? Pulmonary fibrosis is a lung disease affecting the alveoli and bronchioles. It causes them to become fibrosed, which means thickened, stiff, and scarred. This fibrosis prevents the lungs from working as efficiently, and this in turn reduces the amount of oxygen absorbed by the body, and this can lead to symptoms such as shortness of breath, coughing, and fatigue. Types of pulmonary fibrosis. There are several different types of pulmonary fibrosis, each with its own unique characteristics and causes. Most of the time there is no specific cause of pulmonary fibrosis, and hence why the most common type of pulmonary fibrosis is idiopathic. I will be focusing on this idiopathic pulmonary fibrosis mainly during this video. But first, here are other types of pulmonary fibrosis and a brief description of each. Hypersensitivity pneumonitis. This is caused by breathing certain things that cause a reaction in your lungs, which leads to fibrosis. Some examples include farmer's lung and bird fancier's lung. Farmer's lung is caused by breathing in mold that grows on straw, hay, and grain. Bird fancier's lung is caused by breathing in particles from bird droppings and feathers. Occupational interstitial lung disease is also known as pneumoconiosis. As the name suggests, certain occupations and exposure to environmental toxins can increase the risk of developing pulmonary fibrosis. Examples of occupational lung diseases include coal workers' pneumoconiosis, silicosis, and asbestosis. The symptoms may develop many years after having been exposed to the irritants. Pulmonary fibrosis associated with autoimmune diseases. Autoimmune means that your own immune system starts attacking certain parts of your own body for an unknown reason. Pulmonary fibrosis can be associated with autoimmune disorders such as rheumatoid arthritis, Sjogren's syndrome, scleroderma, and sarcoidosis. Certain medications can cause medicine-induced pulmonary fibrosis as a side effect. For example, chemotherapy, amiodarone, methotrexate, and nitrofurantoin. People normally get better if the culprit medication is stopped at an early stage, otherwise the scarring can become permanent. Idiopathic pulmonary fibrosis. It is rare and only around 2 in 10,000 people develop this disease. It usually affects older people, but any age can be affected. It is more common in men than in women. Causes of idiopathic pulmonary fibrosis. There are many potential causes or triggers that cause damage to the alveoli leading to pulmonary fibrosis. These include smoking cigarettes, including passive smoke inhalation, viral infections such as glandular fever or hepatitis C virus, certain medicines, as discussed earlier, pollutants in the environment, rarely, gastroesophageal reflux disease. In some cases, the acid reflux can accidentally go down the windpipe and get inhaled into your lungs, causing damage. Symptoms: shortness of breath. This is the main symptom of pulmonary fibrosis and gradually gets worse as the disease progresses. This happens because less oxygen gets into the lungs due to the fibrosis. Chronic cough, a persistent dry cough that produces little or no mucus. Clubbing of the finger or toenails. This occurs in half the patients. It refers to the widening and rounding of the fingertips and toes. This is painless. Developing more chest infections. Sometimes during an acute exacerbation, the symptoms can quickly become worse for a short period until it is treated. This requires urgent attention. As pulmonary fibrosis progresses, so do the symptoms. Further complications such as heart failure can also occur as a result. How to diagnose pulmonary fibrosis. Your doctor can listen to your chest with a stethoscope and listen for specific changes suggestive of pulmonary fibrosis. A chest X-ray may also show changes. Pulmonary function tests are special breathing tests that can help confirm the diagnosis alongside a CT scan which looks at your lungs in much more detail. If suspected, a biopsy may also be needed through a procedure known as a bronchoscopy. This is a small flexible telescope passed into your lungs so that a biopsy can be taken. Treatment options. While there is no cure for pulmonary fibrosis, there are several treatment options available that can help manage the symptoms and slow the progression of the disease. The main aim of treatment is to suppress the symptoms as much as possible. Here are some of the treatment options that may be advised. Quitting smoking. Smoking is a major risk factor for a range of lung diseases, including pulmonary fibrosis. If you smoke, quitting can help reduce your risk of developing the disease, as well as other health problems. Medications. Certain medications such as steroids may be used during acute exacerbations. Other medications such as pirfenidone and nintedanib may be used as treatment options for certain patients meeting a specific criterion. Oxygen therapy may be required if symptoms become severe. This involves using a machine to deliver oxygen to the lungs through a nasal cannula or face mask. In some cases, people may need to use oxygen therapy all the time, while others may only need it during physical activity or at night. Pulmonary rehabilitation involves a series of exercises and breathing techniques that can help some patients. Education, physical exercises as well as social and psychological support is available also. Getting immunized against pneumonia and flu. These infections can be quite severe if you have pulmonary fibrosis. Lung transplant. In severe cases of pulmonary fibrosis, a lung transplant may be the only option for treatment. This involves replacing the damaged lung tissue with a healthy lung from a donor. Lung transplants can be risky and require a lifetime of medications to prevent rejection, but for some people, it can be a life-saving option. Prognosis and factors affecting it. The prognosis for individuals with pulmonary fibrosis can vary depending on several factors, including the severity of the disease, the individual's age, and overall health. Some patients have a good response to medication and their disease progression is slowed down, however, in others it makes little difference. Some remain stable for many years after diagnosis, whilst others deteriorate rapidly. Support and resources. If you or a loved one has been diagnosed with pulmonary fibrosis, there are many support and resources available to help you manage your condition and improve your quality of life. This may include support groups, patient advocacy organizations, and online forums where you can connect with others who are going through similar experiences. Your healthcare provider can also provide you with information about local resources and programs that may be helpful. Remember, you don't have to face pulmonary fibrosis alone. There are many resources available to help you every step of the way. I have left some links in the description for you to check out. Conclusion. In conclusion, pulmonary fibrosis is a serious lung condition that can cause a range of symptoms and complications. While there is no cure for the disease, there are several treatment options available that can help manage the symptoms and slow the progression of the disease. If you experience any symptoms of pulmonary fibrosis, it's important to see a doctor as soon as possible to get an accurate diagnosis and begin treatment. By taking steps to manage the disease, you can improve your quality of life and reduce your risk of complications. And that's it, guys. I tried to make pulmonary fibrosis super simple for you. My wish is that this information will be a helpful resource for either you or someone you love. As a full-time doctor, my goal with this channel is to share my medical knowledge with all of you to help improve your overall health and well-being. If you found this video useful, please consider subscribing for more helpful content just like this. I'll be publishing a new video every week, so if you have any suggestions for future topics, please leave a comment below. Until then, take care of yourselves and stay healthy.